It's estimated that millions of people have long COVID, and I have no idea what to do with that information. There's chronic fatigue. I've seen D1 athletes that can't do their sport anymore. Like, they're not on oxygen. They don't need to be hospitalized, but they have this chronic condition. And when people come to the ER with symptoms of this and say, I have a diagnosis of long COVID, I really have no idea what to do with that information. And I'm not alone in this, right? There's no FDA-approved drugs or therapies for this. And there's a stigma around it similar to like fibromyalgia or POTS or Ehlers-Danlos that have gradually had more of a stigma surrounding them, not rightly so. But generally in the ER, even if they don't need to be admitted, if they have a chronic condition, there's like somewhere you can send those people, right? If they have IBS or if they have ulcerative colitis or other conditions, sleep apnea, there's like a direction that you can send those people to. And in general, for many chronic conditions, psychiatry is a good resource. Not to say that it's like quote unquote all in their head or it's solely a mental condition, but a lot of chronic conditions have a psychiatric component to having chronic illness, and that can be helpful in developing coping skills and support groups and other resources for people with chronic conditions, right? So I tend to give that as a resource, but I struggle with saying, follow up with your primary for your long COVID. Because I'm sure a primary is also like, I don't know. I've seen people follow up with neurology or pulmonology. But I don't think many physicians know what to do with this information. And I think it's good to be honest about that, In general, our health system likes to punt things to different specialties, and some of that is for benefit, right? There are things that a pulmonologist can treat that I cannot. But I think a little bit of honesty can go a long way in admitting to patients that, I'm sorry you're dealing with these symptoms. These symptoms are very real. And unfortunately, we don't know what to do with that right now.